Assalamualaikum and very good day. Today we are going to discuss subtopic 4.6, that is infertility and contraception. In this subtopic, the learning objective is communicate the meaning of infertility and how to overcome them. Differentiate methods of contraception. Realize the importance of practicing frequent health screening and to get immediate treatment problems related to the reproductive system. And last is criticize the abuse of knowledge on contraception methods and its effect to society. So I hope all of you will focus on this learning objective and try to understand the concept in this subtopic, infertility and contraception. What is the meaning of infertility? So, based on this text, infertility is the inability to produce offspring. When a married couple is unable to bear children, the husband or wife or both may be sterile. So, what is the factors that cause the sterility in males and females? So, from this diagram shows to you about the various factors that can cause sterility in males and females. So we focus on factors of sterility in male first. So the first one is testes cannot produce sperm. Second is low sperm count. Third, produces low quality sperms. And important. So this is several factors that can cause sterility in males. Now we look into what is the factors of sterility in females. The first one is ovaries cannot produce ovum, blockage in the fallopian tube, abnormal uterus, and also tumor in the uterus. So this is the different factors that cause sterility in males and females. There are other factors that also can cause the factor that can cause the sterility for both males and females. Among that is hormone imbalance, defective reproductive organ or organ infected with disease, and health problems like diabetes. So this is the factors. This is the factors of sterility in males and females that you must remember. So now, when the married couple has tried to conceive for more than a year, so means that, and they are still cannot having any children and not successful to having that, so the couple is advised to seek a medical advice. So based on this factor, and if the married couple still do not have any children, so better for them to seek for a medical consultation. When a married couple meet with a doctor, so a doctor may ask several questions, and based on that question, a doctor will give a solution and several methods to overcome sterility. So in this discussion, we will try to look into what are the methods to overcome sterility. Among the methods that usually will be given by a doctor when a married couple get their consultation is, number one, is hormone treatment. Before that, you have to know that all this method is based on the problem given by a married couple or based on the investigation made by a doctor. So based on that situation, this method will be applied by a doctor to a married couple. So the first method is hormone treatment. So this hormone treatment is suitable for individuals who have imbalanced hormone. So hormone will be being injected to the male or female or both in order to overcome the sterility. Second is by surgery. Surgery is done on women who have blockage in the fallopian tube or men who have blockage in their sperm duct. So if the female have a problem, for example at their fallopian tube, so a surgery will be conducted. Or if a male have a blockage in their sperm duct, so this male will be undergone a surgery. Third one is through the method of in vitro fertilization or IVF. In this in vitro fertilization, this procedure is done on women who have blockage in their fallopian tube. This method takes out the ovum to be fertilized with the sperm outside the body in a glass dish. The embryo form is then put inside the uterus. So this diagram will show you the process of in vitro fertilization, in which the fertilization will be conducted outside of the female body, especially in the lab using a test tube, or the normal name for this procedure, we call it as a test tube method. So when embryo is formed during this process, so a procedure or a surgery to put the embryo inside the uterus will be conducted. So we call this as a laparoscopy surgery for blockage in the fallopian tube. So this is the diagram on how in vitro fertilization is conducted. So ovum and sperm are fertilized in a glass dish to form a zygote through in vitro fertilization. So this is among the methods on how to overcome the sterility for both male and female for married couple. What we have discussed before is for the married couple who have a problem to having a children because of their health reproductive system. So they have to find a method to overcome that problem. Now we want to discuss about what we call it as a methods of contraception for married couple who want to plan their family or want to control the number of children that they want. So in this discussion, methods of contraception, several methods can be applied for married couple who want to control the number of children that they want. The first one is by using what we call it as a contraceptive pills. These pills can prevent the process of ovulation, in which we know that ovary will having a ovulation process to produce ovum. So this pill can prevent the production of ovulation. Second is implant. So by putting some implant that is inserted to the skin below the arm, it will secrete a hormone that prevent the ovary from producing ovum. So this is the second method on how to control by prevent the production of ovum from the ovary. Next is by using a condom. Condom is worn over the penis before copulation to prevent the sperm from entering the vagina during ejaculation. The fourth one is what we call as intrauterine contraceptive device, IUCD. So this is a device as shown here. This device, this contraceptive device is inserted inside the woman's uterus to prevent implantation. So this, you can see, this is the device. So it will prevent the process of implantation on the surface of uterus. Next is through the process of surgery for male and female. For male, we call it as a vasectomy, and for female, we call it as a ligation. What is exactly happened during the process of vasectomy is surgery is carried out to cut the sperm duct, and the two ends are then tied to prevent the sperm from being transported to the urethra. So as shown by the diagram here, so the sperm duct here will be cut and both ends will be tied up. So this will prevent the flow of sperm from the testis to the urethra. Same thing, same concept for the female. We call it as a ligation, in which surgery is carried out to cut the fallopian tubes, and the two ends are then tied to prevent the ovum from meeting the sperm. So this is a fallopian tube. So at this fallopian tube, so this part will be cut, and then both ends will be tied, and this will prevent the ovum that we release from the ovary to meet with the sperm. So when the sperm come through this fallopian tube, so cannot meet with the ovum that is produced. So this is the process of surgery on how to get through this process. So it is very important for the married couple to have a frequent health screening in order to get immediate treatment for any problem that related to the reproductive system. This is to make sure that we don't have a longer time to wait for to having any children that exactly become our lovely things in this world. So it is important for both married couple to have or to practice frequent health screening. So an individual is encouraged to do at least one health screening per year starting at the age of 40. And why is it important to do this health screening? The first one is health screening is done as an evaluation to detect early symptoms of chronic diseases. Second, cancer involving reproductive system such as uterine cancer, cervical cancer, and prostate cancer can still be treated if it is detected earlier. Next is practicing health screening can reduce the risk of health problems which require high-cost treatment. The correct and safe contraceptive method can be understood by consulting a doctor during the health screening. So it is very important for the married couple to do or to practice this health screening, at least as given here, at least one health screening per year. I hope that you can understand the method of contraception in order for the married couple to control the number of children that they should have. So, as usual, you have to do this exercise, that is formative practice 4.6, in order to make sure that you understand what is being studied and what is being discussed previously about this subtopic. So from the question number 1 until question number 6, so I hope you can do all these questions in your notebook. After you have finished, write down all the notes for this subtopic 4.6. So as usual, answer this question. Please write the question and then answer the question at the bottom part for each question. So I hope you can understand and try to remember what is being discussed, and I hope you can do all the questions given here. Thank you.